Good afternoon, everyone. My topic is all about first aid. So, what is first aid? First aid is the provision of initial care but an illness or injury. It is usually performed by non-expert but trained personnel to a sick or injured person until definitive medical treatment can be accessed. Certain self-limiting illness or minor injuries may not be require further medical care past the first aid intervention. So, first aid refers to medical attention that is usually administered immediately after the injury occurs and the location where it occurred. So, it often consists of a one-time or short-term treatment and requires little technology or training to administer. So, ang first aid ay ginagawa upang maiwasan yung iniindang sakit and keep the victim alive. And yung gumagawa ng first aid is dapat well-trained. Yan sila, hindi pwede sino-sino lang yung gumawa. So, first aid is emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. So, in serious cases, first aid may be necessary to keep the victim alive. So next is the purpose of first aid. So number 1 is to save life or keep the victim alive. Second is to prevent further injury para malesen yung sakit at hindi na po lumala. And lastly is to preserve vitality and resistance to infection. So this purpose aims of first aid are to preserve life, prevent harm, and promote recovery. So let's proceed to the tips for first aid. So first example is choking first aid. So step 1 is get them cough. You need to hold their chest to encourage them to cough upang makahinga sila ng maayos. The second one is do 5 back blows. So back blows means that hit them firmly on their back with the heel of your hand between the shoulder blades. So, hitting them on their back creates a strong vibration and pressure in the airway, which is often enough to dislodge the blockage. So, dislodging the blockage will allow them to breathe again. And third one is do 5 chest thrust. So, chest thrust is hold around the waist and pull inwards and upwards above their belly button. So, abdominal thrust, squeeze the air out of the lungs and maybe dislodge the blockage. So, let's proceed to the next example. So, next example is sport first aid. So, P is protection, the injury. Stop using the injured limb pad to protect. So, this time, let's protect the injured person. And when the person can handle the pain, let's move them to a safer place using stretcher. So, next is rest the injury. So, rest is to prevent swelling and bruising of tissues. So, and small blood vessels can cause pain and loss of function. And if your child is in pain, then it is important to stop exercising immediately to avoid further damage, like tissue bleeding and can cause bruising and swelling. Next is I is apply a wrap ice pack. So as soon as possible after injury, applying ice continuously for the first 15 to 20 minutes to decrease swelling and pain. And ice pack can be applied to the skin except on the outside of the knee. So unless the child has a known cold allergy. So the safest form of icing is to use a plastic bag with ice cubes or crushed ice or instant cold packs. So letter C is comfortable support, apply a supportive bandage. So after icing, to further prevent swelling, wrap the injured area with an elastic bandage or compression sleeve. So continuously wrap, always making sure to cover half of the previously wrapped area. And as you get closer to the end of the wrap, you don't need to wrap as tightly, and incorrect application of an elastic wrap could cause further pain and damage and delay healing. So So lastly is letter E, elevate to reduce swelling. So elevation is important immediately post-injury to reduce the amount of blood flow to the injured area. So for the lower extremities, these athletes can elevate his or her leg by lying down and elevating the injured part on pillow. So the key is that these athletes needs to have the injured area above his or her heart level. Last example is first aid for burn. So immediate step to take for a burn. So number one is flush the burn area with cool running water for several minutes. So it means that cool the burn with cool or lukewarm running water for 20 minutes as soon as possible after the injury. So never use iced water or any creams or greasy substances like butter. So second is call 911 for a severe burn. If hindi na kaya yung sakit na iniinda, tumawag lang sa 911 for help. And number 3 is apply a burn ointment or spray for pain. If meron kayong ointment sa bahay nyo, please apply para malesen yung sakit na nasunog na part. So lastly is take ibuprofen or acetaminophen for pain relief if necessary. So if meron kayong antibiotic or pain reliever na gamot, please take them or inumin nyo ito to lessen the pain. Lastly is DIY home first aid kit. Start with a small tackle box, small toolbox, or large makeup organizer. Then add items according to the size or specific needs of your family. And create a smaller kit when travel items for hiking or another adventure. So, dapat sa bahay, meron tayong first aid kit for emergency. Dapat you have a bandages. Example nito is yung mga blister pads, adhesive cloth tape or compressed dressing. Next is creams and ointment, 1 tube antibiotic ointment. And medication is 1 bottle for pain reliever. Example is paracetamol and mefenamic acid. Next is yung sa miscellaneous is yung mga space blanket or CPR mask. And lastly is tools. Example nito is yung mga scissor, thermometer, 2 pairs of gloves, and booklet. So, that's the end of my report. Thank you.